There's a letter sitting in millions of mailboxes across this country right now, and it's asking seniors to pay a bill they were never legally required to pay in the first place. It comes from Medicare, or it looks like it comes from Medicare. And the moment you turn 65 and step into this system, the assumption is that you'll just keep paying whatever shows up. Premiums, copays, deductibles, surcharges with names you've never heard of. And here's the part that should make you angry. The agencies collecting that money will never, not once, send you a letter telling you that you might be exempt from it. That's not their job. Their job is to collect. Your job, starting today, is to know which 6 of these bills you can legally stop, lower, or wipe out completely. My name is Julian Voss, and I've spent the better part of 2 decades helping retirees protect the money they spent a lifetime earning. And I want to be very clear about something before we go 1 second further. Being legally exempt from a Medicare cost and actually not paying it are 2 completely different things. There is a gap between those 2, and the only bridge across that gap is 1 phone call or 1 form. Nobody is going to walk you across that bridge. You have to know it exists. By the end of this video, you'll know all 6 of them, you'll know exactly who each one helps the most, and you'll know the single step that claims it. And the 6th one on this list is the one almost nobody talks about because it quietly costs some seniors over $1,000 a year for absolutely nothing. Stay with me, because if you click away early, that's the one you'll miss. Let me start with a story, because numbers don't mean much until you see them happen to a real person. There was a woman, I'll call her Eleanor, 71 years old, living on Social Security and a small pension. Every month, like clockwork, Medicare pulled her Part B premium straight out of her check before she ever saw it. Then came the doctor copays, then the deductibles, then a bill from a specialist for something she was told her plan didn't fully cover. By the end of the year, she had paid out thousands of dollars she genuinely could not afford, eating cheaper food and turning the heat down to make it work. And the entire time, Eleanor qualified for a program that would have paid every single one of those costs for her. Her premium, her deductibles, her copays, all of it. She just never knew it existed because nobody told her. That program is the very first thing on this list, and I'd bet money that some of you watching right now are in Eleanor's exact situation and have no idea. So let's get into it. The first bill you may be able to stop paying is your Medicare Part B premium. Now, for most people in 2026, that premium is pulled automatically out of your Social Security check every single month. You never see the money, so you never question it. But here's what they don't advertise. There is a set of programs designed specifically to pay that premium for you, and they are not just for people living in poverty. The income limits are far more generous than most seniors assume, and they go up every year. If you're a single person bringing in a modest fixed income, or a married couple living carefully on Social Security and a little savings, there is a very real chance you qualify to have that premium paid in full. That's well over $1,000 a year staying in your pocket, instead of disappearing before you ever touch it. The single step here is to contact your state's Medicaid office, not Medicare, your state Medicaid office, and ask about the Medicare Savings Programs. Say those exact words. Most seniors who qualify never apply because they assume, I have a house, I have a little savings, I make too much. You probably don't. Apply anyway. And keep that program name in your mind because it connects to almost everything else on this list. Now, before I give you number 2, I need you to understand why these programs stay so quiet, because once you understand the why, the rest of this video is going to click into place. The system is built on automatic payment. Premiums come out automatically, surcharges get added automatically, and there is no automatic check on the other side asking, wait, should this person even be paying this? The burden is on you, always you. So the seniors who save thousands aren't the wealthiest ones, and they aren't the poorest ones. They're the ones who knew which question to ask. Keep that in mind as we go, because the second item is one that wrongly cost people for years. The second bill is the late enrollment penalty, and this one makes my blood boil because of how permanent they make it sound. Maybe you delayed signing up for Part B or Part D because you were still working and had coverage, or because the paperwork confused you, or because you simply didn't understand the timeline. And now there's a penalty tacked onto your premium, month after month, and they tell you it lasts for life. Here's what they don't emphasize. That penalty is not always permanent, and it is not always correct. If you had what's called creditable coverage during that gap, meaning you were covered through an employer or a spouse's plan, you may have been penalized for a delay that should never have counted against you. People get penalized over clerical errors all the time. Over coverage the system simply failed to record. The step here is to formally request a reconsideration. You have the right to appeal that penalty, to prove you had qualifying coverage during the time they're penalizing you for, and to have it removed. I've seen seniors get years of inflated premiums corrected because they finally challenged a penalty everyone told them was set in stone. Do not just accept it, challenge it. And speaking of challenging things the system treats as final, That brings me to the third item, and this is a big one for anyone who has any kind of comfortable retirement income at all. The third bill is something called IRMAA, which stands for the Income-Related Monthly Adjustment Amount. In plain English, it's a surcharge they add on top of your Part B and Part D premiums if your income is above a certain level. And here's the trap. They calculate that surcharge using your tax return from 2 years ago. 2 years ago. So picture this. You were still working 2 years back, or you sold a property, or you took a large one-time withdrawal from a retirement account, and your income that year looked high. Now you're retired, your income has dropped dramatically, but Medicare is still charging you a surcharge based on the money you made back when you were working. That can be hundreds of extra dollars every single month for income you no longer have. Most seniors just pay it because the letter looks official and final. It is not final. If you've had what they call a life-changing event, retirement, the death of a spouse, divorce, the loss of income property, you can file an appeal and have that surcharge reduced or eliminated based on what you actually earn now, not what you earned 2 years ago. The form exists specifically for this. It's a life-changing event form you submit to Social Security. Fill it out, attach your proof, and stop paying a surcharge built on income that vanished when you retired. Now, I told you at the beginning that the sixth item is the one that quietly drains seniors for nothing, and we're getting closer to it. But the fourth one might be the most infuriating because it's a bill you should never receive at all, and yet it lands in mailboxes every single day. The fourth bill is being charged for preventive services that are supposed to be completely free. Here's what almost no one realizes. Medicare covers a whole list of preventive care at zero cost to you. Your annual wellness visit, certain screenings, specific vaccines. These are meant to cost you nothing. Not a copay, not a deductible, nothing. But here is how seniors get burned. You go in for your free annual wellness visit, and during that visit, you mention a new ache, a concern, a symptom. The moment the doctor addresses that new problem, the visit can get coded as a regular office visit instead of a free wellness visit, and suddenly you've got a bill, or the office simply codes it wrong from the start. I've seen people pay these bills for years, assuming Medicare just decided not to cover them. The step here is twofold. First, when you book that yearly visit, say clearly that you are coming in for your annual wellness visit and you want it billed as such. Second, if a bill shows up anyway, do not pay it on site. Call the provider's billing office and ask them to review the billing code. A huge number of these charges are coding mistakes that get reversed the moment someone questions them. Silence is what they count on. Don't give it to them. That theme, by the way, that the system counts on your silence, is going to matter enormously for the fifth item, because this is where seniors get billed for things the law specifically forbids billing them for. The fifth bill is balance billing, also called excess charges, and this one is protected by law in a way most people have never heard of. Remember that first program I mentioned, the one that pays your premium? If you're enrolled in the strongest version of it, you are legally protected from being billed for Medicare deductibles, coinsurance, and copays by providers who accept Medicare. That is the law. And yet seniors in that exact program get billed anyway, constantly, because the provider's office either doesn't check or doesn't care. They send the bill, the senior panics, the senior pays. I've watched people drain their savings paying bills they were legally exempt from paying. If you are in that program and you receive a bill for a copay or a deductible, you do not owe it and you have the right to refuse it. The step is to keep proof of your enrollment, show it to the billing office, and tell them plainly that you are protected from balance billing under federal rules. If they keep pushing, you escalate it to Medicare directly. You are not being difficult. You are enforcing a protection that already belongs to you, now. The sixth one, the one I told you to stick around for. This is the item that quietly costs some seniors over $1,000 a year, and it's the one almost nobody on television or in those mailers ever explains, because there's no profit in telling you. The sixth bill is the Part D prescription drug cost, the premiums, the deductibles, and the crushing copays on medications, and the program that wipes a huge chunk of it away that millions of eligible seniors have simply never applied for. It's commonly called extra help, and it is a low-income subsidy designed to dramatically reduce or even eliminate what you pay for your prescription drug coverage. We're talking about premiums dropping to zero, deductibles disappearing, and the cost of your medications at the pharmacy counter falling to just a few dollars. And here is the number that should stop you cold. Year after year, surveys find that a massive share of seniors who fully qualify for this help have never enrolled in it. They're paying full price at the pharmacy, sometimes choosing between their pills and their groceries, while a program sits there with their name on it, waiting. The reason is always the same: nobody told them. The income and asset limits are far higher than people think, and recent changes have made even more seniors eligible than before. The step here is to apply for extra help directly through Social Security. You can do it over the phone, online, or with help at your local office. It takes a fraction of an hour, and for the right person, it is the single most valuable thing on this entire list. If you take only one action after watching this video, and you struggle with the cost of your medications, make it this one. So those are the 6. Your Part B premium, which a savings program may pay in full. The late enrollment penalty, you may be able to appeal away. The IRMAA surcharge built on income you no longer have. The preventive care you're being wrongly billed for. The balance billing the law forbids, and the prescription drug costs that extra help can slash to almost nothing. But I promised you a few bonus moves, and these matter for anyone who has spent a hospital stay in the last couple of years, because there's a trap built right into the system that has cost seniors fortunes. Here's the bonus warning, and please pay attention if you or your spouse has been hospitalized recently. There is a difference between being admitted to a hospital as an inpatient and being kept under what they call observation status. They look identical to you. Same bed, same gown, same nurses, same hallway. But the billing is wildly different, and worse, observation status can mean Medicare won't cover a skilled nursing facility afterward, leaving you with a bill that can run into the tens of thousands. The move here is simple, but it must happen during the stay, not after. Ask directly and out loud whether you are admitted as an inpatient or held under observation. Get the answer. If you're under observation and you believe you should be admitted, push for it. Ask the doctor to document the medical reason. And if you're hit later with charges tied to that status, know that there are appeal pathways for it too. The seniors who get crushed by this are the ones who never asked the question while it still mattered. And one more, because I want you walking away with more than you came for. If you're enrolled in a Medicare Advantage plan, dig out your plan documents and look for what they cover beyond the basics. Many of these plans include benefits people pay for out of pocket every year without realizing they're already entitled to them. Allowances for over-the-counter items, dental, vision, and hearing coverage, transportation to appointments, even fitness memberships. I've met seniors who paid out of pocket for hearing aids for years, while their own plan included an allowance they never used because they never read the booklet. Read the booklet, or better yet, call the plan and ask them to list every extra benefit you're entitled to. Make them tell you. Now I want to come back to something I said near the beginning, because it ties this whole thing together. The reason these 6 bills keep getting paid by people who don't owe them is not that seniors are careless. It's that the entire system is designed around automatic payment and silent collection. The money leaves your account before you see it. The surcharge gets added without explanation. The bill arrives looking official and final. And at no point does anyone in that chain have a reason to stop and ask whether you should be paying at all. That's not an accident. That's the design. The only thing that breaks the pattern is a senior who knows the right question and isn't afraid to ask it. That's what separates the Eleanors who pay thousands they can't afford from the ones who keep that money where it belongs. So here's what I want you to do, starting today, not next week, not after you've thought about it. First, write down that one phrase, Medicare Savings Programs, and call your state Medicaid office to ask if you qualify. Second, if you struggle with medication costs, apply for extra help through Social Security this week. Third, if you've ever been hit with a late penalty or an income surcharge that doesn't match your real situation, request a reconsideration or file the life-changing event form. And fourth, never pay a Medicare-related bill on site again without asking one simple question: am I actually required to pay this, or am I exempt? That single habit will protect you for the rest of your retirement. If this opened your eyes to even one bill you didn't know you could stop, do me a favor and share it with someone you love who's on Medicare, because I promise you they're carrying at least one of these costs right now and don't know they have a choice. And if you want me to keep walking you through exactly how to protect every dollar you've earned, the exemptions, the appeals, the forms, the deadlines, all of it in plain English with no fine print, subscribe to Julian Voss Retirement and turn on notifications, because the rules change every single year and the system is counting on you not keeping up. Before you go, let me leave you with one last thought, because it's the thing I most want you to remember. The money we're talking about today isn't a handout, and it isn't charity. These are programs and protections that exist because they were put there for you, funded in part by the taxes you paid across an entire working life. Claiming them is not asking for anything you didn't earn. It's taking back what was always yours. Eleanor finally learned that, and in her first full year with the right program in place, she stopped choosing between her heat and her health. You deserve the same, so make the calls. Ask the questions, file the forms, and stop paying for things the law already says you don't have to. I'm Julian Voss, and I'll see you in the next one.